All right. Hi, everyone. My name is Mark England, and today I'll be presenting on traumatic brain injury, also known as TBI, focusing on its effects, exercise response, and recovery. The goal is to connect what's happening to the brain with how exercise is affected and how we can use exercise safely for recovery. And first, I want to lead with a quick question. How many of you have had a concussion or know someone who has? Slide two here is just the table of contents, kind of just the categories I'll be going over. That's a review of the traumatic brain injury, pathophysiology and clinical presentation, exercise response and rehabilitation, and exercise prescription and case application. We shall continue to the next slide here. And this section pretty much just covers the basics of the traumatic brain injury. And what is a TBI? TBI is a disruption in brain function caused by an external force, like a blow or rapid movement. It ranges from mild concussions to severe injuries with structural damage. And there are also two phases here. There can be either primary injury, which is the immediate damage, and there's also a secondary injury, which includes inflammation, swelling, and reduced blood flow. The secondary phase is important because it drives many long-term symptoms. And TBIs affect cognition, movement, and emotional function, and are commonly caused by falls, sports injuries, accidents, etc. Next slide here, brain structure and TBI. This one we'll discuss neurons rely on axons, myelin, and cytoskeleton to transmit signals. During a TBI, axons can be stretched or torn, causing diffuse axon injury. This disrupts communication between brain regions, and at the same time, a metabolic energy crisis can occur. And during this occurrence, neurons need more energy, but blood flow is reduced. This leads to fatigue, slower reaction time, and coordination deficits. And slide 6 here is going to lead us to the pathophysiology and clinical presentation and patterns of the brain function in TBI. In a normal brain, communication is efficient and coordinated. In TBI, communication is disrupted, signals can be slowed, cognition and motor control can also be impaired. And also fatigue may lead to fatigue increases due to metabolic dysfunction, which is why many patients experience neurofatigue. And what is the risk for TBI? Higher risk groups include older adults typically due to falls, athletes with repeated impacts. Males primarily have a 2 to 3 times higher rate than females getting these concussions or TBIs, military personnel, and young children. Repeated head trauma can lead to chronic traumatic, sorry, I always get this word mixed up here. Traumatic encephalopathy, or CTE. I probably pronounced that wrong, so forgive me, which causes long-term cognitive and mood changes. And slide 8 here, we're going over the progression of TBIs. TBIs progress through stages. Immediately, there's like the mechanical damage, and in acute phases, inflammation and an energy crisis occur. In these subacute phase, symptoms may improve or persist, and long-term recovery may occur. Symptoms may continue. Recovery is often nonlinear, as from the research that I've seen here. And next slide here, where we'll be going over the symptoms. Symptoms can include cognitive, which is typically memory loss and slow thinking. The physical, which is like headaches, dizziness, or balance issues. There's emotional behavioral issues, which can lead to mood changes and irritability. And then sleep disturbances, which also known as like insomnia or even excessive sleep. Severe signs like seizures or unequal pupils require immediate attention. And diagnosis of a TBI. Diagnosis includes clinical evaluation, imaging, and testing. The Glasgow Coma Scale classifies severity from ranges 13 to 15, which is mild, 9 to 12, which is moderate, and 3 to 8, which is severe. And CT scans detect bleeding, MRI detects smaller injuries. So CT is the bigger of the two when you're getting checked out there. But a key point to kind of take away is like normal imaging does not rule out a TBI. Functional tests like SCAT6 and the BESS assess cognition and balance, and diagnosis is based on the combination of these findings. Next slide here. And it's going to be the next group of slides. It's the exercise response and rehabilitation. And we'll be going over the effects. TBI reduces aerobic capacity and causes abnormal heart rate and blood pressure responses. Perceived exertion increases so patients fatigue faster, and balance and coordination are impaired, increasing fall risk. Exercise tolerance is typically reduced and gait becomes less efficient. Exercise must stay below symptom threshold, which is usually like on the on the scale, it's a 0 out of 10, but they usually don't want them going above a 2 on that scale. And that also means that the symptoms should not be increasing much further than that. Otherwise, would have to stop the exercise. And the next exercise here, the next slide, excuse me, is going to be the effects of exercise on TBI. And obviously, exercise is going to help. Exercise improves blood flow, increases the BDNF for brain repair, and improves the cognition. And BDNF is pretty much just a additional protein that the brain creates and helps with lessening those effects. And with exercise, it also helps reduce fatigue, depression, and symptoms, and improves aerobic capacity and balance. Current guidelines recommend starting light exercise after 24 to 48 hours while staying below symptom threshold. Next slide here. This is just a nice image that I found, kind of just discussing the aerobic exercise for traumatic brain injury and rehabilitation, and it just goes over the years, and you guys can take a look at that. So I thought that was an awesome image. And this next slide here is going to be management medications for TBI. There's really no cure for a traumatic brain injury, so treatment focuses just on the recovery. A multidisciplinary approach is used, and medications can affect exercise by altering the heart rate, which also can cause fatigue or impairing coordination. So we must monitor those vitals and adjust exercise accordingly. Next slide here. And we'll get into the next group of slides. This is the case study that I'm going to discuss here. The case study that I kind of came up with is a 25-year-old male, 3 months post-concussion with fatigue and dizziness. His goals are to improve his fitness, reduce symptoms, and return to activity. Testing includes the BCTT, the ROM, strength, and balance testing. And I'll get more into those, but the BCTT is just the Buffalo Concussion Treadmill Test. And you have the range of motion, strength, and balance testing. And part 2 here is just kind of going to be the exercise prescription. This is what I came up with. You guys can kind of read through this. It's fairly common from what we practiced before, but the biggest thing is that we want to be sure that they are cleared for their aerobic capacity first before they really move on to anything else, especially resistance training. The aerobic exercise is like 3 to 5 days per week and should be about 80% of symptom limited heart rate. So again, you're really just going off of the symptom scale for kind of like their rating of perceived exertion. We'll go to the next slide here. And this will be part 3 of the case study. Part 3 is just really just the precautions of it. Key precautions kind of include stay below symptom threshold, monitor heart rate and blood pressure, limit head movement early, progress gradually, modify the environment to reduce sensory overload, and stop exercise if symptoms worsen, as we can kind of see what's labeled there. And usually want to keep them in lower to dimmer light too, which kind of helps with like the symptom overload. All right, and we'll continue to the next slide here. And the next slide I got is going to be the exercise testing. And the exercise testing I came up with was aerobic, flexibility, neuromotor, resistance, and there's a couple other additional tests and considerations. The aerobic is obviously the most important with the Buffalo Concussion Treadmill Test, also known as the BCTT, which I mentioned before. This determines like the safe heart rate and threshold for exercise. Flexibility or the range of motion, the assessment that can be like a simple sit and reach, and this identifies movement limitations and neck-related symptoms too. Resistance was a submax strength test I came up with, which is going to be like 8 to 12 uh, rep max or the body weight. And again, this is just going to be the sub max test. You want to be sure that the aerobic is they clear for aerobic first before you move to a little bit of resistance training. Neuromotor, well, I came up with the tandem gait or walking assessment, and this evaluates coordination and dynamic balance. And additional testing, which is something I mentioned was balance. And a good balance test is the balance error scoring system, which is the BESS, and this measures the balance errors of that patient. And additional considerations that we may take into account is the neurocognitive, which a test for that is going to be the SCAT-6, which assesses memory, attention, and symptoms. And there's another test for vestibular ocular, which is just really going to be for the eyes there, and that evaluates eye tracking and dizziness. Next slide. Next slide, we just go over the precautions here. Precautions. I'm sorry, excuse me, I got to the wrong window there. Precautions, key precautions that I have listed here are just going to be stay below the symptom threshold again, which is the 2 out of 10. The monitor heart rate and blood pressure, limit head movement, progress gradually throughout the workouts and the workout routine, and modify environment to reduce the sensory overload. And of course, if the symptoms get worse, you always want to stop that patient from exercising. Go to the next slide here. And next slide. I don't know if I skipped one, but we'll get to the conclusion. Okay. Yep. I was just making sure we didn't skip a slide. Now at the conclusion, exercise is not avoided; it is prescribed carefully. We want to shift from prolonged rest to active recovery, which is going to be around to 24 to 48 hour window. And TBIs affect both brain function and exercise tolerance. Exercise is not avoided; it is prescribed carefully, which we mentioned. We've shifted from rest to active recovery again. Aerobic exercise plays the biggest role, and exercise must be individualized, progressive, and monitored for those patients. And these are just my references. And thank you for listening to my presentation, and I hope you learned something new.